We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we discuss the latest trending medical headlines and celebrity health news. And we have a jam-packed show for you today. We're going to start off talking about the flu. Yes, this subclade K, this super flu. We have the highest numbers that we've had in 30 years. And so we'll talk about what that means for you. And then we'll talk about RFK Jr. You know, I stay tussling with him. Child, he and his CDC have completely overhauled the previously recommended vaccines. Yes, he's changed the vaccine schedule, and he's talked about shared decision-making. Oh my goodness. So let's talk about what that means to you and what parents should do to get the best advice when it comes to vaccines. Then, you know, we're going to play my favorite little game, myth versus fact. Y'all know Ray J. You got love for Ray J? Well, Ray J has been hospitalized with pneumonia again. Remember, he had pneumonia back in 2021. We'll talk about what that means and what you need to know to protect yourself from pneumonia. Then we'll get back into trending medical topics where I'll give you a fresh take on these headlines you simply can't get anywhere else. We'll talk about Dr. Oz. Oh, Dr. Oz. He says that alcohol is a social lubricant. But what does the science say? And then we'll talk about Khloé Kardashian. These Kardashians, no, they stay in the headlines. Khloé Kardashian basically says she eats like a kid. Well, is that true? Can you eat whatever you want and still lose weight as long as you exercise? We'll break that down. This is live, and so I'll be asking you questions. You can ask me questions, and go ahead and give us a like as we get started because we have a jam-packed show with evidence-based medical information. I'm Dr. Frita. I'm Dr. Frita. This is Dr. Frita Live, where again, we give you the latest trending medical headlines and celebrity health news. But you know I don't do it alone. Will my co-host, Shador, please come to the front of the stage. Shador, how you doing?
Chilly. How are you?
Chilly? Is it cold? Is it cold outside? You know, I think that sometimes I just kind of stay locked up and stay focused. But, you know, it was cold because I have been out and about today. Anyway, did you have a good weekend?
I did. Nice and maintained and quiet. How was yours?
It was good. It was good. It was another big basketball weekend. And both of my little ninth graders did well in their high school games. So I was real proud of them. And I got to go hang out with friends. And, you know, two of my friends who, oh gosh, we've been friends since we were 17 years old at Florida State University in the Landis Honors Dorm. And so we went out to dinner this weekend. And it's just so nice to stay in contact with people who know you and who knew you when. It's just so effortless. And yeah, so it was a good weekend over here too. Well, I'll tell you who's not having a good weekend, Shador.
Mm-hmm.
Some of these folks who have been infected by the flu. And at this point, that's 11 million people, at least in the United States. This super flu is really tripping because we have seen the highest cases that we've seen in 30 years. We've seen the highest cases that we've seen in 30 years. And it's actually driving me bananas because not only have we had 11 million cases, we've had at least 120,000 hospitalizations, and we've had 9 children to pass away from the flu this season. So let's go ahead and play this clip and let's talk some more about the flu and why in the world are the numbers so high this year.
All right, Dr. Freedom, before I jump to the clip, our first in today, our members are showing up. Miss Pauline.
Oh, Miss Pauline, she was the first one in?
First one in.
Hey, Miss Pauline, I hope you had a good weekend. Oh, and I hope you're protecting yourself from the flu. Welcome, welcome.
Absolutely. Followed by Miss Marina.
Hello.
Members as well. So shout out to you, Miss Marina.
Thank y'all. And thank y'all for your continuous support. It is definitely appreciated. And for everyone else, thank you. And please remember, go ahead and just hit that like button now. Subscribe, give us a follow. You know, we're giving you evidence-based medical information. All right, good deal. All right, well, let's go ahead and get into this clip.
Warning about the flu surging across the U.S. in record numbers now. Roughly 11 million cases reported, 5,000 deaths. In fact, 45 states tonight now reporting very high or high flu activity, New York being hit especially hard. And what we've learned this evening about this year's flu shot, how effective will it be in fighting this? Here's Stephanie Ramos.
Tonight, after all those holiday gatherings and travel, a record-breaking surge in cases of the flu that health officials say is likely to get even worse. New York State reporting a record 4,546 hospitalizations, up 24% from the week before.
When it first started spiking, we were seeing a lot more kids, and now the older patients are starting to catch up.
At Mount Sinai Morningside Hospital in New York City, Dr. Eric Lagome tells me they're seeing as many as 30% more flu patients this year than last.
And that kind of tracks what we're seeing across the state or even across the country. We're seeing it earlier, and the numbers we're seeing earlier are much higher.
The CDC says all but 5 states are reporting high or very high flu activity, and more than 8% of all visits to a healthcare provider are for flu symptoms. That's the highest level since they started keeping track. Experts say the predominant type of flu this year, AH3N2, historically hits harder, and this year's predominant strain of AH3N2, called subclade K, is different than the strain that this year's flu shots were designed to protect against.
It doesn't mean that the vaccine isn't working. That vaccine, like we've seen historically, will protect you against severe illness, hospitalization, and even death. So it's still not too late to get that flu shot.
And David, sadly, so far this season, there have been at least 10 pediatric deaths from the flu. Last season, 289 kids died from the flu. That is a record. About 90% of those kids were not vaccinated.
Wow. All right, let's talk a little bit more about this flu. But first, I want y'all to put in the chat and just put flu, just all capital letters, FLU. Have you noticed more people around you getting sick this season? Have you noticed more people around you getting sick this season? If so, why do you think that is? So yes, we know that flu or influenza is a virus that causes the flu. So you can get muscle aches, high fever, fatigue, you can get coughing, you can get shortness of breath, all of these things. And it's, again, caused by a virus. And this year, we have this H3N2 or the subclade K, which is the predominant variant. Now, typically every year we make our flu vaccines and we base it on what we see going on in other continents who get the flu before we do. Typically, we have pretty great communication. World Health Organizations, our CDC is up and running and reputable. We've had some changes, as you know, because I get on here and I talk about it. And also we had the government shutdown. And so quite honestly, there was a time where our communication was not as good as it normally is as far as getting information. Plus, there's been some questionable changes in our relationships abroad to be able to get the information from other countries and other continents. And so this year, our flu vaccine, while still giving some protection, is not as effective as it normally is. It's only about 30 to 40% effective. But guess what? If you're someone who gets the flu, it still will decrease your chances of hospitalization and death by 40%. And so that's what's going on with the flu. We've got more people getting it. We've got kids getting it. Did anyone answer? Are you noticing more people around you getting sick this year?
Yeah, a lot of people in the chat just putting flu. Candace.
Yeah.
Miss Lakeisha, she said both of my daughters have the flu, and I am so worried.
Yeah. Now, if they catch those symptoms of the flu, your daughters, within 48 hours, and they go and see their doctor, we still do have medications that can help. There's something called Tamiflu. There are other medications as well, but you have to catch it within 48 hours of symptoms, and it can help cut back the duration of the flu symptoms. Science says by a day and a half, some say by even more, and then it could potentially help to decrease the symptoms of the flu, but certainly it can decrease the duration of the flu. So if it's within 48 hours, please make sure they see their doctors. And also, if they have the flu, they're sick, and then they get better, and they get sick again, you want to go in and make sure they didn't have one of these secondary complications like flu, pneumonia. Yeah, I hope they get better soon.
Absolutely. Yeah. TS.
Hi, TS. Welcome.
TS coming flu. Not notice around me. I do wear a mask.
Good.
We want to be a crowded store and medical buildings.
TS, and I bet when you go in there with your mask, you're about the only one with the mask on. Isn't it amazing? We know it's cold and flu season. We know that flu is, we have higher cases than we've had in 30 years, but still it's almost like a culture that's shifted, that's changed. A lot of people don't wear a mask, and if you wear one, they look at you like something's wrong with you. But wearing a mask is a great way to prevent getting the flu, because we know that the flu is passed by respiratory droplets. So if someone sneezes and you inhale their respiratory droplets, they're spit droplets, then you could get the flu. Also, you want to make sure you have good hand hygiene so you don't touch a surface that has a virus living on it, then touch your eye, your nose, your mouth, where you can increase your risk for getting it. Okay, I'm going to ask another question as well, but first we'll get into this next story. Did anyone else have anything to say, adding into seeing more people sick around them?
Oh, yes, a member Marina.
I think you being a member.
She said yes, and we're not using safety precautions, hand washing, and coughing out in public.
See, we're on the same page. That's exactly what I'm saying. We're on the same page. Even though we know folks are getting sick and we're in the middle of this season, then people just aren't using the same precautions. But make sure you protect yourselves. And this takes me to my next question. And I want you to put VAX in capital letters, VAX, when you answer this one. If you're comfortable answering, because look, HIPAA's not in effect on this big old public platform. Ooh, give us a like, give us a subscribe, but put VAX and answer the question. Did you get a flu vaccine this year, or do you plan on getting a flu vaccine? Why or why not? Did you get a flu vaccine this season? And do you plan on getting it? Why or why not? And I'll answer that first question for myself. Yes, I'm seeing more people around me getting sick, even up close in family. Definitely at family gatherings, little bitty kids have tested positive for the influenza. Those cute little 3 and 4-year-olds who come and kiss you, yeah, some of them have the flu, okay? And they're fine. And if you're elderly or have an immunocompromised, you might be sick. All right, so go ahead and put that answer for VAX, and we'll go back and we'll revisit that. And now I'm going to talk to you about some complications of the flu. We know that with the flu, yes, you can get a high fever up to 105. You can get the cough, all of those things. But there can also be some long-term complications like a flu pneumonia, or it's possible to be paralyzed by the flu. Did you know that? Yeah, where a 2-year-old young girl in Georgia, Calhoun, Georgia, found that out because there's a little toddler, a sweet little baby, and she developed the flu. Her mom did what she was supposed to do as far as taking her to the hospital. She was diagnosed with influenza, went home, but then the very next day, the mom said this 2-year-old who normally walks and runs and plays, she was not able to sit up on her own. She kept falling over. She couldn't move her arms. She couldn't move her legs. She was paralyzed. And so her mother took her back to the doctor and she received a diagnosis of transverse myelitis. Transverse myelitis. Yes, she was paralyzed as a complication of the flu. So let's go ahead and play this clip and then we'll talk more about that. And I'll find out which ones of you are vaccinated, if you care to share, and then I'll share myself.
A local 2-year-old has spent over 2 weeks in the hospital after being diagnosed with the flu. This comes as the Centers for Disease Control and Prevention reports 11 million people have received a flu diagnosis this season. Newshead reporter Annie Mapp filed this report earlier.
Khloé Lopez tells me 4 out of 6 of her children were hit with the flu last month. She says her youngest daughter, Sara, started to show some unusual symptoms that have left her in the hospital nearly 3 weeks. Khloé Lopez says her 2-year-old daughter, Sara, was battling symptoms of the flu the weekend of December 19th. But when the child struggled to get up, she knew something was wrong.
After a couple of hours of her just being very uncomfortable, we noticed that she really wasn't moving her arms.
The family, who is from Calhoun, took the child to an area hospital where her flu diagnosis was confirmed, but little Sara got worse hours later, leading the family to take her to a hospital in Chattanooga, Tennessee.
And she couldn't move at all. She could just move her head maybe a little bit, but she was completely paralyzed.
It's there where doctors diagnosed her with transverse myelitis. According to the Mayo Clinic, the disorder, which can be triggered by the flu, interrupts the messages the spinal cord nerves send throughout the body, causing pain, muscle weakness, paralysis, and more.
The support that we've received is kind of what has kept me going.
The diagnosis led baby Sara to being intubated for over a week, and her mom says she's still struggling to move.
Isn't that some scary stuff, Shador? Yeah, a lot of people, we hear about infections and we think worst case scenario, maybe they'll have, some asthma symptoms, cough for a while, have pneumonia. And that's kind of what we think the worst of it is. But as we've seen now, we have at least 10 children who've actually passed away from the flu. And when you have such high cases, it really makes you scared. And remember, last flu season, we had 289 children to pass away. But let's talk about this transverse myelitis. So what this is an inflammation of the spinal cord. and it occurs as a complication of certain viruses like the flu virus. And it can happen with other viruses as well. It can happen with the measles, it can happen with the chicken pox. And it's not so much believed to be the actual virus attacking the spinal cord, but it's believed to be an immune reaction. So when you get your immune system revved up and the antibodies are here trying to fight the flu, these antibodies, I guess, get turned around and they mess around and they attack your own spinal cord, which leads to paralysis. So the symptoms can be not being able to move your arms and legs, which is what happened with this little baby, Sarah. You might get pain, shooting pains down your arms and legs. You can get like in the bands of your trunk or your chest, some numbness or tingling. You might get loss of control of your bladder. Okay. So urine incontinence. You might get some bowel dysfunction or bowel incontinence as well. And you might have a difficulty breathing. And we know that little Sarah was actually intubated. Okay. She had a breathing tube down. And so this is very serious. The good news is this. So for Sarah, when they did her workup, this little toddler, they found that she did not have an autoimmune disease causing it, something like a multiple sclerosis or a lupus, and that she did not have a pre-existing condition. So in other words, they really do believe that her transverse myelitis is from a reaction to the flu. And so for most children, they do get better and they do heal. I will say that for kids who are less than 3 years old, sometimes their road to recovery is slower and they might have more long-term neurological deficits. But by and large, most children who get this transverse myelitis related to the flu do heal. What's the treatment? High dose steroids in the IV, intravenous steroids to help decrease the inflammation in the spinal cord. Also, physical therapy, occupational therapy. In some cases, something called plasmapheresis or plasma exchange, where you're hooked up to a machine that looks kind of like a dialysis machine, but it's not dialysis. And they exchange plasma in your blood, trying to get rid of some of these antibodies that are attacking your spinal cord and replace them with antibodies that are calm and have good sense and aren't going to attack your spinal cord. So certainly praying for this 2-year-old little Sarah to do better. They say that she's going to be transferred to Children's Healthcare of Atlanta, which is an excellent facility. But even though transverse myelitis is a very, very, very rare complication, it is real. And we do know that kids are still getting the flu. The American Academy of Pediatrics still recommends that kids get flu vaccines starting at age 6 months. Okay. So consult with your doctor. It is still recommended by all the reputable medical organizations that you get the flu vaccine. So let me see, speaking of flu vaccines, who said vax, who got it, who didn't, if they cared to share, and why not? Because I'm really curious on the reasons.
Yes, absolutely. So Sheree. Hey, Sheree. She says no and never had the flu either. Maybe that's why.
Okay, possibly. And that's interesting because I know a lot of people have never gotten the flu vaccine and have never gotten the flu. At least if they got it, they didn't know it was the flu. And the way that I think of it, and perhaps it's because I'm in healthcare and I'm around sick people. If I were to get the flu, talking about me, myself, Dr. Frita, then pretty healthy person, I'd likely do okay. But if I gave it to, here I go again, talking about my parents. Ooh, child, I hope they don't watch. If I were to give it to my parents who are in their 70s, they might not do so well, right? They might get pneumonia. They might get encephalitis. They might get respiratory failure. If I were to give it, go and pick up one of my cousin's cute little babies and just hug them and kiss them in their face, I might do okay. But the baby who has a less developed immune system might not do so well. When I'm riding in an elevator with some of my patients at Emory Hospital, if I have the flu, I might be okay, even a couple of days before I know I'm contagious. But if I mess around, cough, sneeze, and give it to someone else. So for me, it's less about myself and just more about the community and public health. But a lot of people didn't get the flu vaccine, and even less people got it this year. People who normally get it, a lot didn't get it this year. So I'm curious if there's anyone like that in the chat, if you chose specifically this year not to get it. Thank you.
Candy.
Hi, Candy.
Candy says, not the last couple of years have not gotten the vaccine. I haven't gotten it because it was so painful after COVID.
Interesting. So, and I'm telling, just anecdotally speaking to some family members, I've noticed some people who used to get vaccines, they didn't. I wonder even if some of the misinformation and dysfunction kind of seeps into the subconscious, even of healthcare providers, if they're like, are these people right? Are these vaccines not that good? Well, we see now that we have lower people getting the vaccine, a lesser amount of people have gotten the vaccine by millions. And we see that there's been a very considerable increase in who's gotten the flu, the highest in 30 years. So this really is a correlation, or I guess inverse correlation. And so we'll see how the data bears out. And if we find that we believe that this correlation is more of a cause and effect, then perhaps more people will get the flu vaccine next year. We'll see.
Yeah. Our newest member, Randy, Mr. Randy.
Thank you for being a member, Mr. Randy.
Mr. Randy says, I am planning on getting vaccinated soon. So not yet gotten his flu shot, but planning on it.
Okay, good deal. And it's not too late. I will say that it takes 2 weeks for the flu vaccine to kick in. I do recommend it. And, full transparency, y'all know I got my flu vaccine, and I got flu before Boo. It's recommended that you get the flu vaccine before Halloween for maximum protection throughout the season. Sadly, it looks like this season might be prolonged, and so it's not too late to get it. Okay.
Geraldine.
Hi, Geraldine.
She says, no, are there medical side effects of getting the flu shot to the immune system?
Oh, interesting. So the most common side effect of the flu shot is that it helps protect you against the flu and helps to decrease death and hospitalization. That's plain and simple. Now, you'll hear some people say, every time I get the flu vaccine, I get the flu. No, they don't. No, they don't. And I'm not gaslighting you, because here's what happens. Oftentimes when you get the flu vaccine, it will rev up your immune system, and you might get flu-like symptoms. Okay, you might feel a little achy, a little fevery shortly after the flu vaccine, but that's not the flu. What it is your body's immune system reacting the way we want it to, building up antibodies. And so if you actually do get exposed to the flu virus, you won't be at high risk for going to the hospital for the flu or passing away. But you don't get the flu from the flu vaccine, because guess what? It's a dead virus. The flu vaccine is not an activated virus, so you can't get the flu from a dead virus. But other than that, a very small amount of the population might have an allergic reaction, okay, like an anaphylactic reaction, lip swell, tongue swells. Very rare for that to happen, but most people do well with the flu vaccine. But consult with your doctor, have a full conversation about it. Yeah.
Nana, hello.
Hi.
Says, never received it when I was young, started taking it as I was aging.
Okay, good deal. I wonder so that probably was some shared decision making, which we'll talk about, where your doctor might have recommended it. And I'll tell you, for me, because I've been in healthcare so long, it's recommended by a lot of the hospitals, like at Emory Hospital. I believe if you don't get the flu vaccine, you just have to wear a mask at all times. And then after I had my twins, my little 9th grade twins, they were NICU babies, very vulnerable. And so I was I made sure, of course, that I continued to get the flu vaccine, but then I also made sure that at that time, the person who was helping us take care of our babies, that she started getting the flu vaccine. Any adults who came around them, I made sure that they were vaccinated. My baby's my choice, because they, had been in the NICU, had breathing tubes down their throats, and they were very vulnerable if they had gotten the flu. And because, of course, when you're born, you're less than 6 months, you're not eligible for a flu vaccine. So a lot of us had shifts as we either got older or went to healthcare or just got, different information from our doctors. Good. All right.
VE, I'll show more. VE says no and unsure.
Okay.
So I get some questions there about getting the flu vaccine.
Good deal. Well, hopefully some of the things I said will help to answer the questions. And another thing, they may have mentioned in that clip, when Khloé Lopez, the mother of the 2-year-old who's now paralyzed, said that 4 of her 6 children got the flu this year. All 6 of them were unvaccinated. Okay, unvaccinated from the flu. I don't know if she follows the other recommendations. And that's definitely no judgment on her. A lot of people are unsure. It's not being, and even now from the CDC, we see the RFK Jr. has taken the flu off of the recommended list and put it on a shared decision-making list. So there's a lot of confusion, VE. And when people are confused, they tend to do nothing. But I'm encouraging you not to do nothing, but to follow these reputable medical organizations we trust, like the American Academy of Pediatrics, the AAP, American Academy of Pediatrics, American College of Physicians, National Medical Association, Georgia State Medical Association. You remember we had the president of Georgia State Medical Association right here on our Dr. Frita Live a while ago. And so some of these folks are out here intangible, Dr. Julian Britt, and then, just American Lung Association, American College of Obstetricians and Gynecologists. These folks, even with some of the changing recommendations coming from RFK Jr., who is not a doctor, who did not have experience in public health, who's just, he's not a physician, he's not a medical person, and he's making a lot of changes and putting a lot of disinformation and causing people to be confused. But what I'm pleading with you today is that please don't allow that confusion to lead to inaction. Allow it to lead to action, where you look up the recommendations and the rationale and listen to physicians you trust. Talk to your physician, okay? All right. And so speaking of RFK Jr., let's go ahead and get this tussle started. He made a big change. He overhauled the recommended vaccines. And so we're about to talk about it. Please make sure you go ahead and give us a like and a subscribe and follow us. And for those of you who are new to us, this is Dr. Frita Live. I'm Dr. Frita. I'm an MD. I'm a medical doctor. I have been quadruple board certified. So I am a board certified nephrologist, meaning I'm a kidney doctor and high blood pressure doctor. I am also a board certified internist. So I've been board certified in internal medicine, in obesity medicine, and I've also received a board certification in pediatrics. And that was after I completed my MedPeds residency at Georgetown University Hospital School of Medicine. So it is very important to me to practice evidence-based medicine. I don't like just coming and telling you all things on a whim. When I talk to you, I talk from evidence. I read scientific journals every single day, no exaggeration. I love to learn, and more importantly, I love to share what I learn. And right here on the Dr. Frita YouTube channel, we have over 948,000 subscribers. So we are marching toward 1 million. We have hundreds of videos, and they're filled with evidence-based information. And so if you share these videos with your loved ones, it can help them to be better advocates for themselves. So if you're going to the doctor about something, you're not real sure about it, maybe it's kidney failure or kidney stones or prostate cancer or high blood pressure or, colon cancer, many, many things, stress, anxiety, depression. Check out my videos. I break things down in a way that's easy to understand. And so when you go to the doctor, you won't have to feel so intimidated. You'll have some solid talking points, some solid questions. And what that does is that it creates an environment where you're less likely to be overlooked, okay? It helps to close that healthcare disparity. So make sure you give us a like, give us a subscribe, share my videos. I guarantee you they can help you and your loved ones to have even healthier, happier lives. All right, so let's talk about RFK Jr., shall we? He drives me bananas, y'all. So we know that he's the head of Health and Human Services. And, sadly, we talked about how he lost one of his cousins, President JFK's granddaughter, okay, Tatiana Schlossberg, sadly passed away at the age of 35. And she wrote an essay before she passed away. Y'all should check it out. It was November 2025 in the New Yorker. She published it a month before she passed away. And basically, even she talked about how disappointed she was in some of the choices RFK Jr. was making, her cousin. Anyway, he's now overhauled the CDC vaccine schedule, and he took the list of the 18 recommended vaccines down to 11. And so let's play this clip, and I want you to put this in the chat. Put RFK Jr. in the chat, and please put Jr. because he's very different than his father, RFK Sr., who got assassinated decades ago. Anyway, put RFK Jr. in the chat, and I want you to tell me what was your reaction when you first learned of the changing of the vaccine recommendation schedule. And I also want you to tell me, does this change make you trust the CDC and the government more or less, or does it just make you more confused? So what was your reaction, and does it make you, and what does it mean for your trust in the CDC and the government? Let's play the clip, and then we'll talk more about what this vaccine schedule change means.
Okay. Did you want to do one? You and done, Dr. Frita, or the one you sent me recently?
Oh, with Dawn. Let's see. How many minutes is that one?
I'm not sure. Let's see.
News going into 2026 on health, something positive. I hope, Doctor. I'm trying to start the year on a positive note. What say you?
Okay, let me think. What am I not going to talk about? So, I won't mention the measles because we have the highest cases, over 2,000 higher.
Oh, Lord. RFK.
I won't mention that we're about to lose our elimination status. I won't mention that RFK Jr. has supported cutting billions of dollars from research of the NIH, which is the world's largest sponsor of medical research. I'm not going to talk about that because that's not positive. I'm not going to talk about RFK Jr. cutting almost $500 million from messenger RNA vaccine research that can actually help to cure cancer. So I'm not going to talk about those things. What I will say, as far as things that are positive, is that we each have control to a certain degree of our health. Despite what's going on with insurance, there are certain things we know as far as life. A 2-year-old. All right. So yeah, that was on the when I was on the Don Lemon show just right after the new year. And yes, we definitely got into RFK Jr. and some of his changes. Once you're finished with this live and you check out my shorts here on YouTube, you'll be able to check some of those things out and go through my playlist. But basically, for the RFK Jr. change that he made, he took some very specific vaccines off of the recommended list and put them in a shared decision-making list. Now, I'll tell you all, as a physician, we have shared decision-making with all of our patients in the different vaccines. But by saying something is shared decision-making, what that does is it takes away your autonomy, your ability to be right now, for certain vaccines that are recommended, you could go into CVS, you can go into Walgreens, and you could get the vaccines without having to go and do an extra copay and see your doctor. Now, for these shared decision-making vaccines, it looks like they're going to be recommending that you first see your doctor and you get a note from your doctor or a prescription recommending the vaccine. So what is that going to do? Well, for people who have really busy schedules and they don't have time to go to the doctor more than what their routine visits are, they're not going to go likely. And so they might not get the flu vaccine, hepatitis A, hepatitis C. For people who have very strict budgets, they might not be able to afford the copay to go for extra visits to get letters or prescriptions for their vaccines. Also, for people who have limited transportation, they might not be able to go to the doctor. But even before, they might be able to go to a pharmacy or hop on one of these vaccine mobile buses that come out sometimes in certain neighborhoods. They would have been able to do that before, but with the shared decision making, it makes it more difficult to get a vaccine, even if you decide that it's something that's best for you and your family. So the vaccines that were changed from the recommended list to now shared decision making are flu vaccine, COVID vaccine, hepatitis A, hepatitis C, rotavirus, meningococcal vaccine. And I want you, to understand these vaccines and what they've done to decrease the infections that we used to see so rampantly. It's amazing. A lot of people don't know that before the year 1900, like pre-vaccines, we had a death rate among children. 1 out of every 5 child would pass away before the age of 5, largely due to infections. Okay. But since these vaccines have come around, as well as good, better hand washing, sewage control, largely due to vaccines, we've had a great decrease. Okay. We know that with hepatitis A, since 1996, with this vaccine being recommended on the children's vaccine schedule, we've had a decrease in the cases by 90%. That's since 1996. Hepatitis B, prior when it was recommended, including that birth dose, we have seen a 99% decline in hepatitis B, specifically among teens and children. Okay. We've had a 99% decrease between 1990 and 2019. And that correlates with the time that the hepatitis B vaccine was recommended. Okay. You're getting my drift? So these recommended vaccines actually made a difference in our public health. But now, there's been no new evidence. This is just RFK Jr. making a decision, no independent review. It's not evidence-based medicine, but now less people are going to get vaccines. And it looks like, just like we've seen the highest cases of measles in 30 years, highest cases of the flu in 30 years, high cases of pertussis, whooping cough, we're probably going to have more infections. And with more infections comes more death. Did anyone put in what they thought about these vaccine changes, or if they have increased trust, less trust, if they just don't know what to think?
Hey, Huge, did comment.
Hi, welcome back.
About RFK Jr. and CDC vaccine, I do not listen to anything coming from his recommendations.
Okay. All right. And so the good thing, you're not alone, but organizations like I was mentioning, American Academy of Pediatrics, American Medical Association, American College of Physicians, National Medical Association, if you go on their sites, many of them right now at the top of their sites will say, I strongly disagree with the new RFK Jr. CDC recommendations. So we still do at least have our medical communities that are in unison as far as recommending the previous schedule, because there was science and data behind that schedule. It wasn't on a whim. Good.
Mm-hmm.
Anyone else?
Tisha.
Hi, Tisha.
It does not change my views on any vaccines. I will still get all vaccines needed, and I will make sure that my children and their children get their proper vaccines.
Wonderful. And that's what's going to help public health. And it's not to mean that you don't ever have questions. Yeah, ask questions, ask your doctor, say, why are we getting those? Show me the numbers. Because, a doctor like me will sit up here, go back, show you the data, show you the statistics. We'll talk about the pros, the cons, the risks, the benefits, all of those things. But yes, it's important to be a thinking person and know from where you're getting your data. Very good.
Yep. And Dr. Free, you said this many times. Candy says somebody said he still give his kids the vaccine while he's stopping everybody else.
Baby. Thank you. Come on to the front of the class. You watch what people do more than listening to what they say. That's true. Caroline Kennedy, President JFK's daughter, who just lost her own daughter, said that RFK Jr. and his kids had their vaccine. She said that out of her mouth. And he said that he's admitted that he's gotten vaccines and got his kids vaccinated. And he'll say things like, oh, I wish I wouldn't have done it. He did it. And even your good old President Donald Trump, who has endorsed these changes, when we saw his most recent report for his second annual visit, they shared that he had his COVID vaccine. He had his flu vaccine. So watch what people who have the highest privilege, the highest access to medical knowledge, watch what they do before you listen to what they say, because they'll be sitting here spouting all this disinformation and have all the people who follow them blindly follow them right into a grave while they're sitting up with all of their antibodies from the vaccines. Okay, you said a word. Thank you. Go ahead and give us a like, please. Give us a like, give us a subscribe, give us a follow, and turn on your notifications, because you never know when we pop with different information. All right. And so certainly, my prayers go up for that little Sarah with a transverse myelitis. And again, that's an exceedingly rare complication, the transverse myelitis from the flu. And hopefully she will get better. And hopefully parents will really think about the decisions they make. And you'll follow, like the American Academy of Pediatrics, those recommendations when it comes to protecting your child. All right. Let me ask this question. Do y'all have love for Ray J? Do y'all remember that show? I don't know. So Ray J, we first met him as Brandy's little brother, but very soon he definitely became his own man with his controversies, with his talent. He's a singer, he's a songwriter, he's an actor, he's a reality show personality, love and hip hop. And after his very famous relationship, that's what they call it, his very famous relationship with Kim Kardashian, after that, he had his reality show For the Love of Ray J. Well, Ray J has been hospitalized with heart pains and pneumonia. Let's play the clip and then let's talk about pneumonia.
They got to take it out.
If they see something wrong with my heart, do they got to take it out?
Take your heart out?
We're talking about like fluid or see out.
Oh, yeah.
Yeah. Like if it was like a clot or anything. Probably keep some out of blood.
Yeah, like your heart sits in a sac, and there's a little bit of fluid around in the sac. But is that what you're speaking of? Yeah, like extra fluid, or
you see that?
The cardiologist is going to look at it further. So it takes about 15, maybe 20 minutes at the most. Okay.
Okay. So sadly, Ray J is hospitalized in Vegas. I am glad that he had the good sense and the people around him had the good sense to take him to the hospital instead of trying to tough it out, because Ray J actually reportedly had pneumonia back in 2021, a non-COVID pneumonia. And so he went there with heart pains. He went there with pneumonia. So now everybody get your pencils out and let's play my game. Myth versus fact. Yep. Everybody come to the front of the class, med heads. Let's play. All right. First, myth versus fact statement. What do we have, Shador?
Once you start antibiotics for pneumonia, you're no longer contagious.
Once you start antibiotics for pneumonia, you're no longer contagious. Put an M1 if that's a myth, an F1 if that's a fact. All right. Myth versus fact statement number 2, please.
Walking pneumonia is a mild chest cold that will clear up on its own without a doctor.
All right. So if you got a little walking pneumonia, walk it out. It's going to clear up on its own. Put an M2 if that's a myth, and an F2 if that's a fact. All right, pencils down. Let's talk about pneumonia. And then I'm going to talk about what Ray J was mentioning as far as fluid around the heart, which it sounds like the doctors were checking for. All right, who do we have?
All right, statement 1. Once you start antibiotics for pneumonia, you're no longer contagious. Overwhelmingly, Dr. Frita, myth. The real ZARP.
Really?
There's a myth.
All right.
Yolanda, hello.
Hi, Yolanda.
Myth. Tisha agrees. Hey, KK says myth as well.
Okay, KK. Okay.
VE.
Hi, VE.
Marina.
Hey, Marina.
Eunice.
Hey, I mean, all y'all said myth.
Everybody said myth.
All right. Dang, I can't trip y'all up. I got to make these questions harder. That's correct. It's a myth. It's a myth. But here's the deal. So once you start taking antibiotics, at some point, we shall hope you will no longer be contagious, but it's after 48 hours. So you can't just pop an antibiotic in your mouth and be like, okay, I'm ready to go outside, or just get one dose of an IV antibiotic. It takes at least 48 hours. Also, we want you to be without a fever, a febrile for at least 24 hours. And I mean, without a fever reducing agent. So even if you're taking no Tylenol, acetaminophen, no ibuprofen, no Motrin, 24 hours with no fever, and also at least 48 hours after starting the antibiotic. All right, let's do myth versus fact number 2. Let me see if I tripped y'all up on this one.
All right. Walking pneumonia is a mild chest cold that will clear up on its own without a doctor.
What did they say, Shador?
All right. We have Anton joining the chat.
Hey, Anton, welcome back.
Anton says myth.
Ooh, Anton.
Angela Eyes disagrees, says fact.
A fact. If it's walking pneumonia, you can just walk it out and you don't have to go to the doctor, okay?
Purple Onion says a myth.
Hey, Purple Onion, welcome back. All right, Purple Onion.
Hey, Miss Aileen. She says.
Hey, Miss Aileen, never disagrees. What say you, Miss Aileen?
She says myth.
She says the myth. All right.
Sky's limit says a fact.
Sky's the limit. You say it's a fact. All right.
And William says a myth.
William says the myth. Listen, y'all, when I say I want to trip y'all up, I don't really want to trip y'all up, but I know that if we have different answers, myth, fact, that means, okay, this is a good one because there's learning to be had. Okay, so walking pneumonia, can you just walk it out? You don't have to see a doctor, no clear up on its own. This is actually a myth. This is a myth. And we call it walking pneumonia because the symptoms tend to be less severe than a typical bacterial pneumonia, but it still is pneumonia. It is still caused by bacteria, and you still do need to see your doctor, and you do need to get antibiotics in order to clear it properly. So let's just take this and let's just talk about pneumonia in general. Pneumonia is an infection or an inflammation of the airways and the air sacs or the alveoli. It can cause inflammation, pus in the lungs. It can give you symptoms like high fever, like 105 degrees Fahrenheit, shortness of breath, low oxygen, fatigue, can have many complications. It can cause chest pains or heart pains. And that's what Ray J felt. And typically for bacterial pneumonia, the most common cause is streptococcal pneumonia or that pneumococcal pneumonia. But there are other things that can cause other bacteria like Legionella, Haemophilus influenza. And then you can get what they call a walking pneumonia because those symptoms tend to be more atypical, maybe a drier cough. You might not get as high a fever. You might not be as fatigued. And so that's why they call it walking pneumonia, but it's still from a bacteria. Mycoplasma is the bacterium, and there is antibiotic treatment that we give for it. So even though you're walking around with less symptoms than like a typical lobar pneumonia, it still is pneumonia. It's still caused by bacteria. You still are recommended to go to the doctor and get antibiotics so that it gets better and so that you don't get some complications. Very good. All right. And one thing I want to say before we slide on to the next, Ray J in that clip we saw was talking about, you know, are they going to take it out? And he was talking about if they see fluid around his heart. So if they see a pericardial effusion or a fluid around the heart sac, that can be a complication. Or if he had pericarditis, inflammation of the sac that surrounds the heart. And with him being 44 years old, Ray J, and going in with heart pains and pneumonia, certainly it would have been standard of care for them to make sure he didn't have a heart attack, make sure he didn't have a blood clot to the lungs or a pulmonary embolus, which can cause heart pains. They need to make sure of all of those things because he's checking for heart pain. And if they were looking for fluid around the heart, they likely did an echocardiogram, an ultrasound of the heart. And that's probably what happened. So I am praying that Ray J gets better, that he heals quickly. I know he has all kinds of controversy, stakes in the headlines. Quite frankly, he drives me bananas, but I do certainly wish him well, because this is serious, especially since he's a pretty young guy and just had pneumonia in 2021. And now he has it again. I hope he heals and does well, because I got love for Ray J. All right. Y'all, please give us a like, give us a subscribe, give us a follow, because we're giving you evidence-based information. And make sure, because when you subscribe and put your notifications on here on the Dr. Frita channel, you'll have access to all of these hundreds of videos I have. I'm telling y'all, go check out these videos and then come back. Tell me about it next week. I'll be here. I'll listen. You're going to learn from the videos, and you're going to be like, ooh, I'm going to share this with my auntie. I'm going to share this with my uncle, my granddaddy, my grandma, my sister. You're going to be able to find information about just about any common medical condition, and it'll allow you to advocate for yourself and ask the questions you need to ask when you see your doctor. All right, can we talk about Dr. Oz? So y'all know we first met Dr. Oz on the scene thanks to Oprah. Thank you, Oprah, because he had the Dr. Oz show, and you know, so many of us helped to build him up by watching. We know that he's historically a cardiothoracic surgeon. He was trained in medicine, trained with evidence. And so he knows what evidence, shows. Yet we see him even just recently when he was talking about the flu, he was talking about how to prevent the flu. He said everything, vitamin C, zinc, healthy lifestyle. Sure, all those things will help to build your, enhance your immune system. But he didn't say flu vaccine, knowing that there's evidence to support it. Well, now Dr. Oz is talking about alcohol, and he says that it's a social lubricant. Well, what does that mean? Well, let's watch this clip, and then we'll talk about the evidence.
So alcohol is a social lubricant that brings people together. In the best case scenario, I don't think you should drink alcohol, but it does allow people an excuse to bond and socialize. And there's probably nothing healthier than having a good time with friends in a safe way. If you look at the blue zones, for example, around the world where people live the longest, alcohol is sometimes part of their diet. Again, small amounts taken very judiciously and usually in a celebratory fashion. So there is alcohol on these dietary guidelines, but the implication is don't have it for breakfast. Right? This should be something done in a small amount with hopefully some kind of an event that might have alcohol added. But the general move away from 2 glasses of men, 1 glass of wine, there was never really good data to support that quantity of alcohol consumption. That data was probably primarily confused with broader data about social connectedness.
Ooh, I want you to put a wine glass emoji in the chat, and I want you to answer the question: do you think people rely too much on alcohol to connect socially? Do you think people rely too much on alcohol to connect socially? I want you to put that in the chat, and then I want you to tell me why you say what you're saying. Now, watching Dr. Oz, have y'all ever seen the movie Get Out? If you have, and you know the premise, I'll try not to do too many spoilers, but sometimes while the person who has been changed by whatever it is that happens in the movie to change them, sometimes their old personality will glitch and kind of come through. Okay. So they've been changed and Get Out, okay, kind of to act a different way, but that old personality, the old way that they are, the true themselves will glitch. And that's what it felt like was happening with Dr. Oz just then. We know that just recently there's been a change in the food pyramid. They pretty much flipped it upside down under RFK Jr., where they're saying to eat more saturated fats, to eat more red meat, all of the things that we know over years of data. don't make a lot of sense. Okay. No one ever said totally get rid of red meat if you don't want to, totally get rid of saturated fats. But we talked about the numbers in moderation. But now these things are on the top of the food chain. We also know that with alcohol, and Dr. Oz knows it as well, because if you listen carefully to his words, he kept saying kind of under best case scenario, he said under best case scenario, you shouldn't drink alcohol. And that's because even though we used to talk about, moderate or acceptable amounts of alcohol, now the data shows us that the risks of alcohol outweigh any benefits that we used to think that they might have cardiovascularly. In other words, there is no medical society that is now recommending alcohol at all. Are we saying absolute, don't do it? People can make their choices as far as what they're going to do moderately, but from a medical perspective, there's no medical support from reputable medical organizations that there's nothing that says this is the safe amount of alcohol. There's no safe amount of alcohol that we recommend anymore. Dr. Oz knows that, and if you listen, he kept saying it. You can, but he does say, and he makes a point that people will use alcohol to help to lubricate them socially. So then my question to you, med heads, do you think that's true? And do you think that people rely on alcohol too much? We'll talk about that, and I'll talk to you about some of the old recommendations for what was considered safe or moderate alcohol intake. And now back to the current recommendations. We don't recommend that anyone drinks alcohol. Anyone comment?
Mm-hmm. Yeah, several has commented. Brandon, hello.
Hi, Brandon.
Brandon says yes, it usually loosens inhibitions.
It does, Brandon. I mean, that's just the truth. You walk into a social setting, you might have a little bit of social anxiety. First thing you do is go over to the bar or to the island, get you a little something to drink. Well, now you don't feel as awkward as far as going up and joining a conversation. So it does decrease inhibition. Now, does it have consequences on the health? Yes, certainly if it's done in high amounts, but that's just the fact that it does decrease inhibition. It does.
Mm-hmm. Sorry, 1 second. The real Zarp.
Hi.
Says 100% yes, I don't drink, and folks have always looked at me weird for not doing so, especially as a man.
You do become a social pariah. And it's sad, right? Because by you're not drinking, you're actually following medical recommendations. And we know that alcohol can increase your risk for high blood pressure, for cardiovascular disease, certainly for liver disease, cirrhosis, many other things. It can increase the risk for all of those things. But if you don't drink, which is actually a healthy thing, like no, you won't be the social pariah if you exercise or if you eat fruits and vegetables, or if you have a healthy weight, but you will be looked at like, why you don't drink? Oh, maybe he's an alcoholic and that's why he don't drink. Like they feel like there has to be a reason other than just your choice. The other thing that people do, and tell me if you notice this at parties, come on, you got to have one drink. Come on. There's a high social pressure. And so that's interesting. But yes, but if you choose not to drink, then please do not be pressured by people because the medical community actually supports you.
All right. Lisa.
Hi, Lisa.
Lisa says, yes, folks definitely get together more when there's drinking involved.
It's true. It's true. And I was looking at Married to Medicine, and Dr. Jackie on Married to Medicine on Bravo is not a drinker, and she was hosting an event, and you had Toya in the car and Dr. Contessa in the car. If y'all watch the show, you know those characters. And Toya was like, it's not gonna be any alcohol because Dr. Jackie doesn't drink. And then Dr. Contessa was like, don't worry, I brought something for us. So people really sometimes will like not really want to go to an event if there's no alcohol there. And so it kind of adds to what Dr. Oz is saying, that it's a social lubricant. But do you think that people use it too much as a social lubricant? Anyone else?
Tisha.
Hi, Tisha.
Tisha says, I noticed that sometimes people create social events just to drink. Example, paint and sip.
You're right. You are correct. Social events just to drink. And what about baby showers? I remember when I was young and maybe used to go with my mom to baby showers. Those were totally dry events. You might have a little bit of ginger ale there and some punch. Now, the last several baby showers I've been to, first of all, the men folks are there sitting up in there. And there's like full bars or just everybody's getting lit down to the baby shower. So yeah, they'll do paint and sips, and even what used to be dry events are loaded up with alcohol. That's interesting.
Very, very interesting.
Okay. Yeah. But bottom line, again, the recommendations have changed somewhat recently. When I was in training, it was thought that if you had some red wine every day, that was something that would promote heart health. But now we find, again, that the risks of the drinking actually outweigh the benefits. And also, before, even just in recent years, there was a recommendation. They said that for women, having an average of 1 drink per day was considered to be a safe or moderate limit. And for men, having 2 drinks a day, okay, for men younger men. And, they talked about binge drinking and what was considered to be over drinking. But now the recommendation is to have no drinks per day. Now, if you're someone, especially if you're doing January, we're in January, dry January, make sure if you're someone who's used to drinking a lot, okay, or you're someone who drinks or even gets intoxicated, that if you're going to stop cold, consult with your doctor, because you certainly don't want to get delirium tremens or the shakes or any type of complication from stopping suddenly. But again, the recommendation is to have none, because we found that with all the complications that I mentioned, that it's just not worth it to drink. Now, I do want to tell you the definition of a drink. A drink is not one big tumbler full of dark liquor, of Hennessy, of bourbon, of whatever. A drink is very specific. It is 5 ounces of wine or 12 ounces of beer. Or if it's something like a stronger liquor, like an 80 proof liquor, 1.5 ounces. That's what's considered 1 drink. All right. But make sure you consult with your doctor to make whatever decision is best for you. But from a medical perspective, we no longer recommend any alcohol as a safe amount. I do believe that Dr. Oz knows that, and he was trying to get his message across as clearly as he could while still slipping in his recommendation of not drinking. Okay. All right. Any more comments as we slide on?
No, Dr. Frita, but can I shout out Miss Elaine, our member?
Hey, Miss Elaine, thank you for being a member.
And our newest member. Before we dive into what we do. Yeah, we have a newest member, Miss Desiree.
Hi, Ms. Desiree. Well, I love that name. Thank you for joining us. Listen, I have all kinds of members only videos for you, depending on your level that you joined in. And also at the top tier, the chief residents, every month, we have a live members only Q&A. For that, I don't sit up here and I'm not a D1 yapper, as my daughter calls me. For that one, I do the listening. And so you can come up to the stage if you like. You can ask all the questions you want during that time. And, so if you have hospital bill or, doctor's visits coming up, you're concerned about a family member, then for that members only Q&A, that's the time for you to bogart and to ask the question. So thank you for joining us. We appreciate you.
Absolutely.
All right. Have y'all been keeping up with the Kardashians? I don't know. I feel like I talk about them quite a bit. They're in the headlines, and here on Dr. Frita Live, we talk about the latest trending medical headlines and celebrity health news. Well, Khloé Kardashian, which some might argue has been a bit of the black sheep in the family for a while. Well, she says that she can eat whatever she wants, or I'm sorry, she eats like a kid. She eats like a kid. And it's interesting because we know for the longest time, she was living with being overweight. I don't even know if she ever reached a BMI of being considered to be obese, living with obesity. But compared to her petite sisters, people would look at her, they would call her out of her name concerning her weight. They would talk about how she looked, all of this stuff. But now she's sharing how she pretty much eats like a kid. And so my question to you, and I want you to put KK in the chat, just 2 Ks. Don't put 3 Ks in my chat. Just put 2 Ks for Khloé Kardashian and tell me, do you think it's true? Do you think you can eat whatever you want as long as you exercise? Okay. And tell me why. But let's play this clip and let's talk about what Khloé says as far as how she's maintaining her weight.
I feel like I talk about this, but I don't think anyone believes me. I am not the best eater. Like, I eat fine, but I just love snacks. I'm a huge myself a grazer because I love to graze throughout the day. But I also don't have this profound worldly taste palette. I like the kids menu and I like a lot of fried food, pastas, that kind of stuff. And I would rather just kick my ass in the gym.
Okay. Did anyone comment already with just 2 Ks and not 3? Do you think that that's the case, that as long as you exercise, you can eat whatever you want? Anyone weigh in?
Few people did. Miss Rosalind.
Okay.
Says no.
You disagree. Okay. Anyone else?
Yolanda also said no.
Okay.
Sky's the limit says somewhat.
Okay, so kind of it depends. And guess what, sky's the limit? I'm kind of with you on that, on the somewhat, but we'll talk about it.
I remember Mr. Randy says, no, I don't, because your body needs certain nutrients from foods.
Okay, good, Mr. Randy. Yeah, and thank you for being a member. So I will tell you, you can eat whatever you want as long as you exercise. It's funny with Khloé, we know that she has struggled with her weight publicly, for years. And sometimes I feel that for people who have struggled with their weight or who've been picked on for their weight or living with obesity, once they finally get to be skinny or thin or more accepted by society, I think sometimes they put out there what they always wish they could have. Because let's just say growing up, some of you are the person who could eat whatever you wanted to and you stayed skinny. Some of you aren't. Some of you really would try to struggle, and you look around and people who are eating more than you are thinner than you. And they're just like, oh my God, I eat whatever I want, eat whatever I want. And maybe you had a little envy for those people, like, dang, I wish I could eat whatever I want. And now Khloé is good and grown. And she's like, and it sounds like she's saying, oh, I eat fried foods, I eat whatever I want. I don't know how completely honest that is, and I'll tell you why. I'm not trying to call you out, Khloé Kardashian. I just want to make sure that on this channel, on this Dr. Frita Live, that no one follows Khloé Kardashian down the wrong path. So you can eat whatever you want as long as you don't want to eat a lot. And that is what I'm saying is the case with Khloé Kardashian. So she mentioned that she's a grazer. Well, based on the size she used to be, she wasn't maintaining that high weight by just being a grazer. She was probably eating a lot. But for her to say she eats what she wants, she's probably made a conscious decision to want less. The other thing is, I definitely believe she works out hard. I know she was once sharing how she did 2-a-days. I believe she does all of that. I believe she puts in the hard work. What I don't know is if she also gets a little help, like by GLP-1. No, I'm not saying that she does. There's certainly nothing wrong with it if she does. But let's just say, sake of argument, let's just say that she is taking something like an Ozempic or a Mounjaro, Zepbound, Wegovy. Then her eating whatever she wants, well, she's going to want to eat less, because by the nature of those drugs, they cut back the food noise and make you eat less. So I'm just saying, be careful of the language. Yeah, I eat whatever I want. If I'm taking a medicine that suppresses my appetite, I want less. So I can eat whatever I want and maintain size. So the bottom line, though, is that anyone who is maintaining a healthy weight most likely is not overeating consistently with high calories. Now, let's get back to her, like talking about fried foods and kids' meals. And put this in the chat for me, please. And put kid, KID. If you sometimes will get yourself a kid's meal, like for moderation. So you might get the fried food, unhealthy food, but you might be like, ooh, I'm just gonna get the kid's meal. Put that in there, put kid if you do it, and tell me why. So with her and the kids' meals, I do believe that maybe sometimes she'll get fried food, French fries, and eat those things, but she's still probably doing it in moderation. Very likely. I just don't believe that you go from having a not so fast metabolism when you're 15 to now being in your 40s and you can eat whatever you want, go to the gym and be skinny. There's a balance. Yeah. Not saying that she is lying outright, but I definitely believe that her overall caloric intake is relatively low for her to be able to maintain a small weight. That's just what it is. That's just science. All right.
Dr. Free, you might not say she's lying outright, but Candy.
What Candy say? You said Candy?
Candy Cole says she's lying because she has to be taking the shot because I know I can eat something, but I want because of the shot. So Candy has to eat what she wants, so she has to be lying.
Candy, I'm just to go. Now you heard me, Candy. I just tied myself in a pretzel, making sure I didn't sit up here and call the lady a liar. And here come Candy. All right. So Candy, I'm assuming that you assume that someone like her who used to be living with obesity to now be pretty skinny, exercise or not, is likely getting a little help. She certainly has access. Again, nothing wrong with it, because unlike some people who were already skinny but took GLP-1s to get skinnier, for Khloé Kardashian, she probably had a BMI at some point of greater than 27. And if she had a little high cholesterol, high blood pressure, pre-diabetes, then really she would qualify, be eligible for the medical FDA recommendations. But anyway, Candy, you killed the set. Thank you for being here. She made me have to leave the show. I'm back.
Well, Candy did say she does get the kid meal because of moderation.
Okay. See, so Candy. Okay. Can I answer the question myself?
Yes.
Sometimes I do it sometimes also. I know I preach against fried food. I stand by that. I preach against saturated fats. I stand by that. I preach against doing all those things regularly. But you also notice that I say in moderation. So sometimes if these kids are running down to the Zaxby's or whatever, and I know I should get a salad, every now and then I'm like, you know what? Instead of me getting a big old 3-5-piece meal, I'm gonna get me a little kids meal just today, and then I'll be good tomorrow. So, but there's nothing wrong with moderation. You know, from a physician standpoint, no. This is me telling you, I don't recommend the fried food, saturated fats, all of those. Those are not healthy. I'm standing by that. Being honest as a human, every now and then I'll have me a little something in moderation, and that's not going to be the norm. Okay.
Well, alternatively, Rosalind, she says kid because of the cost.
Oh, so you're doing it on purpose. So instead of paying $8 for the adult combo meal, you might pay closer to $3. Well, in it, you get the moderation also. Okay. But again, not recommending that. We're just being a little bit honest here today. Mm-hmm.
Yeah. Tisha.
Hi, Tisha.
Tisha says, I get the kids meal when I do eat out. I don't eat a big back meal, and it usually comes with a fruit sometimes.
Okay. Now, you know what? That's true too. Because if you get a kids meal, I don't even want to promote them, but there's some people where you can get grilled nuggets instead of fried nuggets, and you can get a fruit cup instead of fries. Then of course you can get a water, and I've done that as well. Mm-hmm. And interestingly, my youngest daughter, my 9th grade daughter, is pretty good about that. She'll get grilled when she can, or grilled chicken wraps, and she'll request fruit, apple slices when we have to do fast food. So she's got some pretty good habits.
Mm-hmm.
And again, every now and then she'll get fried, but moderation. Okay, who else we got?
TS.
Hey, TS.
TS
been with us a long time. Mm-hmm.
TS says, I don't get kids meals. I don't get kids meals since I am plant-based, and most meals like McDonald's have meat and the fries are in beef tallow. If it works for some, that's great.
You're right. And let me tell you, it's not actually working for some. Be clear, TS, what you are doing and being plant-based is the right thing. And that is my recommendation. And it's interesting you mentioned beef tallow, because you see with this new food pyramid that they flipped upside down, they have beef tallow up at the top, when honestly, if you read the details in the text, that goes against the amount of saturated fat that's being recommended. So y'all, please do not follow this new upside down food pyramid. Follow the old one, the one that we had most recently. People are not unhealthy or having poor diets because of the food pyramid. If they're having a poor diet, it's because they weren't following the food pyramid that we had before. Don't follow all that red meat, saturated fat, all that stuff that's at the top, and don't follow that. Yeah, go ahead and have alcohol in moderation. That's not the recommendation. If you have alcohol, no, I'm not judging you, but I'm letting you know from a medical perspective, that's not the recommendation. And these kids' meals, even though we're having, true confessions, these are my confessions like Usher, that's not the recommendation. TS, what you're doing, the plant-based, is going to be the best for your heart health, period.
Yeah. And VE, on that note, VE says kids' meals are just as unhealthy and high in calories.
Absolutely. Yeah. I mean, by virtue of the amount, the smaller amount, it might have less calories, but absolutely, they still have the saturated fat, all those things. So Khloé is saying it's something that she does. I've had true confessions saying that sometimes I've done it. Absolutely, it's not the recommendation. I'm not recommending by any means that you do the kids' meals. Yeah. Y'all know I just come on here and tell the truth. Lord help us. Yeah. All right. Well, I certainly thank y'all. Ooh, y'all medheads had a lot to say today. I loved it. I think 2026 is going to be a great year. I think it's going to be a great year. Please make sure that you give us a like, a subscribe, and a follow. Share us. Please go share us on WhatsApp. Share us on your email. Share us on your group me. Go share it. Go tell it on the mountain. Let people know that we are here and we're giving evidence-based information. In fact, before you go, just please click the little share link copy link, copy paste, and let people know. So if they're here, like on the replay crew, thank you to everyone on all social media platforms who joined us here today. Make sure you go to my website, drfrita.com. That's my one-stop shop. And on there, also, I'll put it in a link in the description. I have a freebie for you where you can download my 10 healthy habits for a better you and a better life. And again, making sure you follow me on all social media platforms to let you know when I have different appearances, like the Don Lemon one that we shared earlier, like the News Nation ones. But thank y'all for being here. We'll be here again next Monday, same bat time, same bat place for Medical Monday, where we do our live stream, Dr. Frita Live, where we give you the latest trending medical headlines and celebrity health news. And again, thank you for making Monday your healthiest day of the week.